Hey guys, Dr. Travis McDermott here today again, talking to you about vaccines. So, little disclaimer, everybody has different opinions on vaccines, and I'll tell you the same thing I tell you every other time. It's your pet, not mine. You decide what you want to do. I just want to provide you with the most amount of information I can so that you can make a decision and one that you feel comfortable with. Okay, so first question, what are vaccines? Vaccines are something that we give to your pet that have a low level or killed version of a virus that they can be infected with. Okay, so we expose the body to it, the immune system readily beats it because it's either injured or dead, and the next time it sees it, it knows how to attack it and beat it. Okay, this is going to help prevent infections that are vaccinated for in your pet. Okay, now we're going to look at both dog and cat vaccines. We'll start with dogs. Now I will say something that's another important disclaimer is that the vaccines that I'm going to be talking to you about, they may differ from what your veterinarian recommends because you may be in a different area. I'm going to be speaking specifically about Las Vegas and the things that we see in the vaccines that we routinely vaccinate for. So we don't see things like Lyme disease or leptospirosis, which your vet may recommend that you vaccinate for. And it's important that you listen to them because they're going to know what's in your area. Okay, so core vaccines for us in Las Vegas are going to be things like distemper and parvo. Distemper and parvo are viruses that attack the intestines of puppies, sometimes older dogs if they're not vaccinated. And distemper can also attack the brain and the lungs, and so these things can they can be deadly. And so they're very, very preventable by vaccinating. Okay, the next vaccine that we use routinely is one called Bordetella. Now, Bordetella is also known as kennel cough. So if your dog is around other dogs, whether it be grooming, boarding, dog park, Petco, PetSmart, anything like that, then that's something that's important. Okay. The last one that we use in our core set of vaccines is rabies. Now, most of us have heard of rabies. Rabies is the one vaccine out of all these that is required by law. So in Nevada, if your dog is over the age or cat is over the age of 12 weeks, then they need to have a rabies vaccine. Okay. Now those are our core vaccines. Now distemper and parvo is given once a year. Bordetella is given every 6 months if they're exposed to other dogs, once a year if they're not, very often, and then rabies is every 3 years after the initial vaccines. Okay. Other vaccines that we often talk about, influenza. So canine influenza is a respiratory virus that attacks dogs. It is newer than the other ones, and we are seeing cases in Reno and in California, so we are now recommending it for our clients and requiring it for boarding. Like I talked about, there's also vaccinations for Lyme disease as well as leptospirosis. These are things that we don't routinely see, but if our patients are going to those areas, we'll recommend them. Cats. So for cat vaccines, the most common one we use is feline distemper. It's known by numerous names. Some people call it a 5-in-1 or 6-in-1. It has numerous respiratory viruses in it that we want to protect cats against. The other one we use is rabies, which we talked about. It's the same as dogs. It's required over 12 weeks of age. The other vaccine that we use in cats is feline leukemia. Now, we generally recommend that mainly for cats that are outside because they're exposed to other cats that have it outside. It can be deadly, and so we want to make sure we protect them against it. Now, vaccinations in cats is a little trickier than it is in dogs. So in cats, they can actually develop a cancer associated with the vaccine. That being said, it's very, very rare. I have seen it before, but it doesn't happen very often. And the chance of them picking up some sort of disease is more likely than the chance of them getting a cancer, so we still recommend it. But if their exposure is low, we try to reduce the amount of vaccines. So a lot of people ask me, why do you guys require vaccinations for when my pet comes to the hospital? If they're here for boarding or procedure or something like that, they're going to be around other dogs. And I am responsible for all the dogs that are in the hospital. So I take that very seriously. So if you're at home and your dog never leaves, or you take it someplace and you don't bring it here, it's your choice. I'm not going to tell you what to do. You decide. But if I'm responsible for your pet and the other dogs and cats around it, it's going to get vaccines if it's going to be here. So as we get older, we do try to taper off some of the vaccines if they've been routinely vaccinated. But it's important that you talk to your veterinarian about that, because every veterinarian is different in the way that they look at stuff. And it's important that you and your vet are comfortable with your plan for vaccines. So vaccines are an extremely important part of the preventative care that we do for your pet. I will tell you that we're not raking in the dough of vaccines. I mean, it's not a huge money maker for veterinarians. We do it because it's important, and we do it because we get to do an exam on your pet every year for that, and it's important that we look and find preventative things, and we do that by doing exams. So talk to your veterinarian about vaccinations. If you have any questions, you can always comment on our Facebook page, Dr. Travis McDermott, Vegas Vet, or check us out on YouTube at the same name. Like and share the video, please, if you like it. And next video that we're going to try to do is going to talk a little bit about puppies and puppy care, and we'll touch a little bit on vaccine schedules for puppies on that as well. So hope you guys have a great weekend, and we'll talk to you soon.